Hi everyone, I'm Dr. Divya Swetha, consultant at Ankura Hospital, Madinaguda branch. Today let's talk about the diet plan in the pregnancy. How we can plan the diet so that it will be easily made at home and also it can which will be helping out to gain good appropriate weight during the pregnancy. So extra calories intake which is needed in the pregnancy around 150 to 300 calories depending on your weight and also your physical activity. So in the first trimester, you need to eat lot of food. So first trimester actually is a survival phase. So because most of the women will be suffering with the nausea and vomitings. So in this first trimester, try to avoid foods which will trigger your vomitings and nausea sensation, and try to avoid masala and salty and spicy foods, and try to eat bland foods like idli, dosa or pongal, which will be easy to make and also which can be giving you proper nutrition with a single meal. And try to keep some things food in hand like dry fruit laddus or pali chikki like this, so that you will be able to gain your diet like calories, and also you don't have to eat a lot. The main thing especially in the first trimester to conquer is try to have something like even less quantity but very frequently, like once in 3 hours. This is very important because in the first trimester with the nausea sensation, if you give lot of break between your meals, there is a high probability of you getting acidity, and this acidity in turn triggers your vomiting sensation further higher. So have small and frequent meals in the first trimester. And coming to from the second, third trimester, you actually has to increase your intake of the protein and other supplements. So in the form of like, for example, calcium. Calcium main source is dietary intake. Dietary products are the main source for calcium supplementation. Even though we will be taking calcium in the form of tablet, along with that you need to take additional calcium in the form of milk, buttermilk or curd, or in the form of paneer, etc. And protein is very important. So protein you need to plan. For example, you are 50 kg body weight in your pregnancy, so you need to at least take 1.5 grams per kg per day of protein need to be taken. So for example, you are 50 kg, then at least you need to take 60 to 70 grams of protein per day. So you need to divide it into 2 or 3 portions. So for vegetarians, the source of proteins are lentils in the form of dal or chickpeas or groundnuts, etc. And for non-vegetarians, egg, fish and chicken are good easy supplements for the proteins. And in the pregnancy, you also need to take your omega-3 fatty acids, which are very important for the baby brain and also growth of the baby. Usual source of omega-3 fatty acids is a fish. If you are a vegetarian, you can't take this, then you can get supplement in the form of omega-3 capsules. And vitamin C is also very important for the development of the baby. You need to take lots of in the form of oranges, guava, lemons. All fruits, seasonal fruits have lot of vitamin C, all need to be taken. And you also have to take your fruits and vegetables, especially dark leafy vegetables like spinach and the local varieties. You need to take for the supplementation of the iron. And you also need to take your eggs as much as possible, which has a realistic amount of vitamin D to be needed in the pregnancy. And you need to take your dry fruits and nuts. Dry fruits and nuts not just have the calories, like it has a good amount of fats which will be helping you out fat requirement of the baby, and also it will help you out with the solid meal in between the main meals. So in the form of dry fruit laddu, all you can keep it handy. So especially working women, we always advise you to carry a snack in the form of like easy available and dry fruit laddu and chikki you need to carry in your bag, and always carry a couple of fruits like apple or a banana, which are easy to carry and you can eat it anytime. So don't stay like give a break for a lot of time, like more than 4-5 hours in between your meals. Have something, and always plan your diet when ahead, like a step ahead, like at least a couple of days before, so that you will be able to procure all the groceries beforehand, and you will be able to plan it ahead. And also you can avoid last minute binging from outside. Okay, yeah, thank you so much.